So today I'm going to explain regarding the shoulder complex and why shoulder is called as a complex. This is because shoulder complex is formed of more than one joint. It is mainly formed of four individual joints. Out of these four individual joints, three joints are called as the anatomical joint or the structural joint, and one joint is called the non-anatomical joint or the non-structural joint or the physiological joint. Now let us see which are the structural joint and which are the non-structural joints. The structural joints are the glenohumeral joint, the acromioclavicular joint, and the sternoclavicular joint. Okay, and the non-structural joint is the scapulothoracic joint. This non-structural joint is also known as the functional joint or the non-anatomical joint. Let us see how these structural joints are classified. Structural joints are classified mainly of two categories. The first category is that structural joints are classified according to the type of the structures by which these articulating structures are joined. Again, structural joints are classified according to the type of structures by which the articulating surfaces are joined together. Secondly, the structural joints are classified according to the shape of the articulating structure. According to the shape of the articulating structure. First, let us see how these structural joints are classified on the basis of the type of the structures by which the articulating structures are joined together. According to the first category, according to the type of the structures by which the articulating structures are joined, structural joints are classified into three categories, which includes the syn-arthroidal joint, the amphiarthroidal joint, and the diarthroidal joint, or otherwise is called as the synovial joint. Now, what is a syn-arthroidal joint? In a syn-arthroidal joint, the structure, the articulating structures are joined together by the fibrous connective tissue. The articulating structures are joined together by the fibrous connective tissue. What is a connective tissue? Connective tissues are structures by which the various structures in the human body are joined together. Okay, so what structure by which the connective tissues are made up of? These connective tissues are made up of collagen fibers. What is a collagen fiber? Collagen fiber is considered as a structural protein. It's a structural protein within the cell. Okay, what all are the connective tissue? So now we saw fibrous connective tissue. So what are the other connective tissue? Cartilage is a connective tissue. Okay, blood is a connective tissue. Bone is a connective tissue. Skin is a connective tissue. So altogether, connective tissues are structures that joins various structures in the human body. So coming back to the syn-arthroidal joint. So syn-arthroidal joint are joints where the articulating surfaces are connected by the fibrous connective tissue. It can be of fibrous connective tissue. It can be of loose connective tissue. It can be of dense fibrous connective tissue, or it can be of elastic connective tissue. Under this syn-arthroidal joint, the subcategory of these joints are the sutures, gomphosis, and syndesmosis. First, let us see what are the sutures. Sutures are type of syn-arthroidal joint where the bonds are connected, the articulating surfaces are connected together by the fibrous connective tissue. What is the particular feature of the suture joint? The suture joints, the movements are not possible in the suture joints. Movements are not possible in the suture joint. When I say movements are not possible, I have to specify that movements are not possible in a normal adult sutures. Why I say normal adult suture? During the developmental stages, due to the development of the brain, there can be movement of the sutures occurs in children. And if any pathological condition happens to the brain or the skull, there can be movement occurs in the suture. Okay, so that's why I told in a normal adult individual, movements are not possible in a suture. So what are the different types of sutures? What are the different types of sutures? So sutures can be seen in the skull. The suture which connects the frontal bone, the suture which connects the frontal bone, the suture which connects the frontal bone with the parietal bone is called the frontal suture or the coronal suture. So the suture which connects the frontal bone with the parietal bone is called the frontal suture. This is the, so if I take this skull, this is the frontal bone and this is the parietal bone. So this is the suture. The suture which connects the frontal bone with the parietal bone is called the frontal suture or the coronal suture. And you can see this is the parietal bones. And the center of this parietal bone, the suture which separates the two parietal bones are called the sagittal suture. The suture which separates the two parietal bones are called the sagittal suture. And you can see this is the occipital bone. The suture, this is the suture. The suture which separates the occipital bone with the parietal bone is called the lambdoidal suture. And again, the suture which separates the temporal bone with the parietal bone is called the squamosal suture. So those are the different sutures of the skull. And now let us see which is the bone which has got connection with all the sutures. Name the bone which has got connection with the frontal suture, the sagittal suture, the lambdoidal suture, and the squamosal suture. The answer is the parietal bone. Okay, that's about the suture. The next subcategory of synarthroidal joint is the gomphosis. What is a gomphosis joint? Gomphosis joints are the joints formed by the socket of the mandible or the maxilla. The teeth inside the socket of the mandible or maxilla is an example for the gomphosis joint. Again, movements are not possible in a normal adult individual. Again, movements are not possible in a normal adult individual, but in case of children, where if the milk teeth goes, there is a different scenario. And in the old age person also, movements can be possible in a gomphosis joint. But in a normal adult individual, movements are not possible in a gomphosis joint. And the third subcategory of synarthroidal joint is the syndesmosis. What is the syndesmosis joint? Syndesmosis joints are joints which can be seen between the radius and the ulna. The interosseous membrane which is seen between the radius and ulna is is made up of fibrous connective tissue. And again, the joint formed between the tibia and the fibula, which is in the fibrous connective tissue, joins these two bonds together. So but the only thing which is different from the suture joint with the syndesmosis joint is that movements are possible in syndesmosis joint. Slight movements are possible in a syndesmosis joint. Those are the joints comes under the category of synarthrodal joint. So again, the synarthrodal joints are joints where the articulating surfaces are joined by the fibrous connective tissue. Okay. Coming to the second category of structural joint is amphiarthrodal joint. What do you mean by an amphiarthrodal joint? And amphiarthrodal joints are joints where the articulating surfaces are combined by the cartilage. There are different types of cartilage. You can see the hyaline cartilage, you can see the fibrous cartilage, you can see the elastic cartilage. So amphiarthrodal joints are joints where the articulating surfaces are joined together by the cartilage. So what are the examples of joints comes under hyaline cartilage? Is the ribs and the sternum. Sternocostal joints is an example of amphiarthrodal joint under the subcategory of hyaline cartilage. Hyaline cartilaginous amphiarthrodal joint. Example is the sternocostal joint. And what is the examples of an amphiarthrodal joint where the cartilage is made up of fibrous cartilage? Is the symphysis pubis. The symphysis pubis, the two symphysis pubis are connected together by a fibrous cartilage. So it comes under the category of cartilaginous joint. Again, the fibrocartilaginous disc can be seen between the intervertebral joints. Intervertebral disc is again made up of the fibrocartilage. Okay, so that's about the amphiarthrodal joint. The third subcategory of structural joints are the diarthrodal joint. Again, it is also known as the synovial joint. So what are the features of a synovial joint? The synovial joints, again, from the name, it is made up of a synovial capsule. It has got the synovial fluid in it. And movements are possible in this joint. 3 degrees of movements are possible in a diarthrodal synovial joint. So the next division of the structural joints can be classified on the basis of the shape of the articulating structures. So the first category was the structural joints are classified according to the type of structures by which the articulating surfaces are joined together. So in that category, we had seen the synarthrodal joint, amphiarthrodal joint, and diarthrodal joint, or the synovial joint. So next, let us see how these synovial joints, are classified. Sorry, the structural joints are classified according to the shape. According to the shape, structural joints can be classified as the ball and socket joint. Example, the shoulder joint and the hip joint, where you can see the ball-shaped head of the humerus or the head of the femur articulates with the glenoid fossa or the acetabulum of the hip joint. And the second category is the plain synovial joint. Plain synovial joint where the more gliding movements are possible. Example is acromioclavicular joint. Next is the saddle joint, is also called as the sellar joint. Saddle joint or the sellar joint. Example is the sternoclavicular joint. So here in a saddle joint, just like a rider sitting on the saddle. And here the articulating surface are reciprocally concavo-convex. Okay. And another example of saddle joint is the carpo-metacarpal joint of the thumb. The first carpo-metacarpal joint. So here the first metacarpal bone articulates with the trapezium. Another example for the trapezio metacarpal joint of the thumb is an example for the saddle joint. Then the condyloid joint. Condyloid joint example is the temporomandibular joint is an example for the condyloid joint. Another example is the radiocarpal joint between the distal end of the radius and the first carpal bone. Which is the first carpal bone? Scaphoid. The scaphoid and the radius, the joint. This radioscaphoidal joint is an example of condyloid joint. So that's how the structural joints are classified according to the shape of the articulating structures. Next, let us see how these non-structural joints are classified. So what do you mean by the non-structural joint? This non-structural joint, as we see in the example, is the scapulothoracic joint. This non-structural joint doesn't have any of these characteristic features of the structural joint. That means it doesn't have any fibrous connective tissue or a cartilaginous connective tissue or a synovial connective tissue. These structures, so in case of scapulothoracic joint, scapula is seen in the posterior thorax 2 inches from the midline. Can be seen from the posterior thorax 2 inches from the midline, from the second to the seventh rib. Okay, and you can see the scapula is attached with the acromion process of the scapula is connected to the lateral end of the clavicle, and in turn this clavicle is connected to the manubrium sternum. Okay, so that means whatever movements that is taking place at the acromioclavicular joint as well as the sternoclavicular joint, a simultaneous movement is taking place at the scapula. Even though scapulothoracic joint is considered as a non-structural joint, the movement that is taking place in the scapula is very, very important in order to complete the range of motion at the glenohumeral joint, acromioclavicular joint, or the sternoclavicular joint. I can give an example. If you want to do movement at the glenohumeral joint, in order to do glenohumeral abduction, this humeral humeral contribution means the muscles which get inserted into the humerus can do movement only up to 90 degrees. That's the supraspinatus and deltoid can only do movements up to 90 degrees. Supraspinatus up to 0 to 15 to 20 degrees. Movements can be done by supraspinatus. And up to 90 degrees can be done by the deltoid. But shoulder abduction through elevation is 0 to 180 degrees. The rest 90 degrees of range of motion is done by the scapulothoracic joint. That is the movement of the scapula on the thorax, which is done by the upward rotation of the scapula, mainly done by the trapezius and the serratus anterior, which is considered as a scapular muscle whose insertion into the scapula. Of course, trapezius has got insertion to the clavicle too. So what are the movements that is possible during the shoulder abduction? During the shoulder abduction, after 90 degrees of shoulder abduction, The movement is done by the upward rotation of the scapula. Is done by the upward rotation of the scapula. These upward rotation of the scapula, the axis of motion is taking place at the acromioclavicular joint of the acromioclavicular joint. And what all are the movements that is taking place at the acromioclavicular joint due to the movement of the scapula? So whenever there is any movement, associated movement occurs at the sternoclavicular joint. What are the sternoclavicular joint movement? Elevation and depression, and protraction and retraction. Those movements are occurring at the sternoclavicular joint. So when there is a protraction occurs, what is happening to the scapula? Scapula is rotating, external rotation of the scapula. When there is a protraction, there is an external rotation of the scapula. And when there is a retraction, there is an internal rotation of the scapula. Okay, so when there is a protraction and retraction, there is an internal rotation and external rotation of the scapula take place. And when there is an elevation and a depression, again, scapula moves from its axis of rotation. So when there is elevation, scapula will move upward. There is an upward rotation of the scapula, and when there is a retraction, there is a downward rotation of the scapula. Simultaneously, there is an anterior tipping as well as a posterior tipping of the scapula occurs due to the movement at the sternoclavicular joint. When there is a protraction movement, when there is a posterior tipping of the scapula. What do you mean by the posterior tipping? Posterior tipping means the inferior angle of the scapula is moves posteriorly. During protraction, what is happening? The inferior angle of the scapula moves backwards, and during retraction, what is happening? The inferior angle of the scapula moves anteriorly. So all these movements are taking place at the scapulothoracic joint. So even though scapulothoracic joint is considered as a non-structural joint, the movements in the scapula on the fixed thorax is very, very important in order to complete the functional range of motion at the shoulder joint. So with that, we just finished the basic of the structural joints.